Hey there, and welcome. If you or someone you care about has ever looked into ADHD medication, you know it can feel, well, kind of overwhelming, right? Today, we're going to cut right through all that confusion. We're going to give you a super clear, simple guide so you can finally understand all the options out there. Let's make sense of it all. I mean, seriously. You hear all these names thrown around: Adderall, Concerta, Vyvanse, Ritalin, and your head starts spinning. What's the actual difference? How are you supposed to know where to even start? It's so easy to feel lost, but don't worry. We're about to hand you the map. And here is that map, our game plan for today. First, we're going to tackle that medication maze and make it simple. Then, we'll look at the two main highways, stimulants and non-stimulants. After that, we get really practical. We'll talk about choosing a path, dealing with side effects, and my favorite, busting some major myths. And we'll wrap up by giving you the exact questions to ask your doctor so you can walk in feeling totally empowered. All right, first things first, let's bring some order to this chaos. You know, the secret to navigating this whole thing isn't about memorizing dozens of brand names. No way. It's about understanding that they all fit into just a couple of really simple categories. And that whole framework, it really starts with one single question that cuts through almost all of the noise. Are we talking about a stimulant or a non-stimulant? Seriously, that's it. Every single ADHD medication fits into one of these two buckets. This is the most important distinction you need to know. So here's the difference in a nutshell. Stimulants, they're kind of like the first responders. They are by far the most common treatment. They work fast, often within an hour, and they're super effective for the vast majority of people. Non-stimulants, on the other hand, are more of a slow and steady wins the race kind of deal. They take a few weeks to build up in your system, but then they provide this really smooth, around-the-clock coverage. They are a fantastic option, especially if stimulants just don't feel right or cause tricky side effects. Okay, so since stimulants are the most common route, let's zoom in on them for a minute. Why are there so many different kinds? I know, this is where it gets confusing for a lot of people, but I promise you, it's way, way simpler than it looks. You ready for this? This is the big secret. Pretty much all of those brand names you've ever heard of belong to just two chemical families. That's it. You've got methylphenidate, that's your Ritalin and Concerta, and you've got amphetamine, that's your Adderall and Vyvanse. Boom, just like that, we've basically cut that entire confusing list in half. So you're probably thinking, okay, if there are only two families, why all the different names? And that is a great question. It all boils down to just two things: duration, which is how long the medicine lasts, and delivery, which is how it gets into your body. Let's look at each one. And this visual just lays it out perfectly. Imagine this. You take a short-acting medication at 8 a.m. It's great. It gets you through the morning, but by noon or so, the effect is gone. Now, compare that to a long-acting version. You take it at the exact same time, 8 a.m., but it's designed to give you smooth, steady coverage for 10 or 12 hours, right through the end of the workday, homework, and evening activities. See the difference? And then there's delivery, and this is all about making it work for you. I mean, think about a little kid or even an adult who just can't swallow pills. A standard capsule is a total non-starter, and that's why there are so many brilliant options. You've got chewable tablets, liquids you can mix into applesauce, and even a patch you just stick on the skin. This variety just makes sure there's an option that can fit pretty much anyone's needs. So let's put it all together. It's like a formula. You take one of the two chemical families, you combine it with a specific delivery method, and you pick a duration. So for example, a long-acting or extended-release capsule is totally different from a short-acting or immediate-release tablet. This simple grid explains the entire landscape. So now when you hear a new medication name, you know what to ask. Which family? How's it delivered? And how long does it last? You've cracked the code. Okay, now that we've got the framework down, let's get super practical. We have to talk about side effects. But here's the thing. Instead of thinking of them as deal breakers, let's reframe them as manageable challenges that have clear, actionable solutions. Let's start with a big one: decreased appetite. The trick here is to be strategic about it. You want to start the day with a huge, calorie-packed breakfast before the medication has a chance to kick in. Then, you schedule small meals and snacks during the day, even if you're not feeling hungry. And don't forget liquids. Smoothies and nutritional shakes can be a lifesaver. Finally, take advantage of that returning appetite in the evening with a really good bedtime snack. Trouble with sleep can also be a real challenge. The solution? Build a fortress of good sleep habits. Consistency is everything. Go to bed and wake up at the same time every single day. Yes, even on weekends. Give yourself a power down window. Maybe set an alarm for 90 minutes before bed where you dim the lights and do something relaxing. Obviously, avoid other stimulants like caffeine later in the day and turn your bedroom into a cool, dark, quiet sanctuary. All right, it's time for one of my favorite parts, myth busting. There is so much misinformation out there that can cause a ton of unnecessary stress and anxiety. So let's just clear the air and separate the fact from the fiction. Okay, this one is huge. It's a massive fear for so many parents and adults. They worry that if they start a prescribed stimulant, it's somehow a gateway, that it's going to lead to substance abuse issues down the road. It's a really scary thought. But here is the fact, and the research on this is incredibly clear. The exact opposite is true. When ADHD is treated properly with medication, it helps reduce impulsivity. And that impulsivity is a huge risk factor for substance abuse. So treating ADHD doesn't increase the risk, it actually lowers it compared to leaving ADHD untreated. Here's another one I hear all the time. This worry that the medication is going to change who a person is, especially a child. That it'll turn this vibrant, energetic kid into, a zombie or just dull their spark. Look, the whole point of medication is to manage the challenging symptoms, not to change the person. If someone seems flat or overly quiet or irritable, that is not the goal. That's actually a signal. It's a sign that the dose might be too high, or that maybe that specific medication isn't the right fit. It just means it's time to call the doctor and talk about making an adjustment. So with this clearer understanding, how do you move forward? Well, the final and honestly the most important step is to become an active, informed partner in your own care. You're not a passenger anymore. You're the co-pilot. Here are some absolutely essential questions to bring with you to your next doctor's appointment. Ask them why they chose this specific medication. You want to understand the reasoning. Ask, how will we know if this is actually working? Define what success looks like together. Know what side effects to look for, what to do if you miss a dose, and talk about options like taking a break from meds on weekends. These questions make you a key part of the team. Because at the end of the day, there is no single best medication that works for everybody. The only best medication is the one that works best for you or for your child. It's a partnership, a process of finding that perfect fit. So now that you're armed with all this information, what's the first question you're going to ask?